I have a dream. Red, white, and blue, fly free, fly free. I believe, oh, I believe. Will you dream with me?
Welcome to Changing Times. I tell you what, it is another hot day in Springfield, Missouri. This is a show that we have every Wednesday at 10 a.m. It's a very fast-paced 40-minute show, and we've got another lineup of great guests today. And, you know, one of the things that I want people to know about this show is we're talking about social issues and things that are very important, not only in Southwest Missouri, but around the country and around the world. And today we do have some really good guests. And I am the co-host, Lynn Morris.
And I'm Don Blackard.
Don Blackard. And hey, Don, how do people, we're on live right now at 10 o'clock our time, but if they miss this show and they want to pick it up in the afternoon or tomorrow or even Saturday or Sunday, how do they pick up our show?
Well, one, you need to go over and like the Axe Media Group page, and you can follow us. You can look back and watch our past shows that we did on sex trafficking, autism, addiction, and you can go back and look at any of our Changing Time shows. We're also on YouTube, so you can find us on both places.
Yeah, foster care, education, public education. We've had some great issues, so you might want to go back and look up each one of those shows and watch it. And we really appreciate it. One of the things that we really would love for you to do, because we know that every time we have a show, we're going to help somebody. Somebody is going to hear something that will make a difference in their life, and share it. Like Don said, share it and like our page and let your friends and family members know about this show, because this is week 11. So we are still continuing. They haven't kicked us off the air yet. And
we also have that giveaway going on with Axe Media Group. So invite your friends and family over, because they're giving away $100 a week. So someone won $100 yesterday just for being a follower of Axe Media Group, and someone's going to win it this week. So,
well, I need to win that, because I just gave Jackie $100 for 13 ducks for the race that he's going to be talking about, Toma Duck Race. So now I'm out $100. I need to win that too. So you need to do that. So, hey, we're going to go ahead and get started with our show today. And our first guest is Jackie Barger. He's the executive director of the Children's Smile Center in Ozark, Missouri, Aurora, Missouri, and also Branson West.
That's right. It's good to be here.
Hey, welcome. I tell you what, so you stay very busy.
Yes, sir.
And, why a lot of people don't really understand what the Children's Smile Center does.
Okay.
So it only takes care of children age groups from what?
Well, let's just jump right in.
Yeah.
Children's Smile Center is a nonprofit organization that was established in 2006 in Ozark to provide dental clinics to care for children from low-income families who are covered only by Medicaid. Now, that's a lot of kids. In some of the smaller rural communities, as many as 60 to even 70 and 80% of all the kids in a given school district are going to be covered only by Medicaid because of their income status. And for all of these children in the counties that we serve, I'll mention that in just a minute, for all of these kids in our counties, the only place they really have to turn are the offices of Children's Smile Center. For so many of them, in the past, the only option they had was to drive to Joplin or to drive to Springfield for the federal clinics, who do a great job. But the demand is overwhelming in the entire system. There's got to be clinics closer to home. And over time, you're seeing more clinics that are established throughout the state of Missouri. But for us, we provide care to children from Christian, Stone, Taney, Lawrence, Berry, and Dade counties, that 6-county area just south and west of Springfield. And we know at any given time there's about 30,000 kids that are covered by Medicaid. And for the most part, they don't have a dentist that's reasonably close for them to access. Another big story in a different direction, but I'll just give you a nugget of it. Transportation is still the number one barrier to access health care for low-income school-age children. And studies continue to show that over and over. So our clinic locations are in Ozark, Aurora, and Branson West, and even for all, well, especially for Ozark and Aurora, we still see people driving from as far as 20 to 30 miles away for the Ozark Clinic. We see folks driving 30 to 50 miles one way to access our Aurora Clinic. Even though we serve those 6 counties, our Aurora office has seen a dramatic increase in folks from Jasper, Newton, McDonald counties that are saying, we're looking for a dentist. Will you take us in Aurora? And we've started seeing some kids outside our 6 county area on the west side because they can't find access to see a dentist. Now, that phrase that I just said, to see a dentist, is important. For all of us here in this room right now, if we have an issue or we wish to make sure we're taking care of our oral health, we're going to make an appointment with our dentist. Don, you and Lynn both, you have told me who you would go see for your dental care to have good oral health. You'll make an appointment. You'll go in. You'll be seen by professional staff. You'll be cared for in a state-of-the-art facility that's going to provide up-to-date services for you. You're going to get x-rays. You're going to get an exam. You're going to get a cleaning from a hygienist. And you know what? We feel like every segment of the population, no matter what their age or their income, deserves that same professional healthcare service. And in a way, we discriminate against the low-income population if we say that your access to care is going to be only a van, here today, gone tomorrow, or it's going to be a limited access, limited services in a school, but then 2 or 3 months later, that limited access service, where are they in 3 months? If you fall on the playground, chip a tooth. And my challenge is, where's the van then? Kids have got to have a permanent dental home. That's a technical term that the dental industry uses. A permanent dental home is crucial for everybody's overall health, not just oral health. That's what we do in the locations where we are. We have state-of-the-art facilities, professionally trained staff, Monday through Friday, 8 to 5. I wish we could do more hours than that. But guess what? Our folks, a lot of our folks, they've got young kids at home, and their work hours are 8 to 5 Monday through Friday because they have responsibilities with their own families. We hear time and time again from our patients and their families how much they love, not like, love coming to the dentist. If I had $1 for every time I heard this from a family, I wouldn't need to do any fundraising. But they've said, our kids used to be afraid to go to the dentist. They're not afraid to go to the dentist anymore after coming to see you. One of the core values of what we do is positive experiences. And that's what we want for kids and families, to have a positive experience when they go to the dentist. For a lot of folks in the past, they've not had a positive experience. We try to provide some coaching, especially to grandparents. If it's time for a procedure, or it's time to get the mouth numb to do some work, we try to coach grandparents. Don't talk about your experiences 30, 40, 50 years ago with dentistry, but just tell them everything's going to be fine. They're going to take care of you. It's not going to hurt. And we'll get whatever work done we need to get done. Now, saying that, I would say that there's a misconception about dentistry, and this is not based on income level, that you go to the dentist when you got a problem that needs to be fixed, right? That's good, and I hope people do that. But for the most part, if you can go to the dentist every 6 months for a checkup, cleaning, x-rays, and fluoride, and you get an evaluation from a dentist who can catch things very, very early, you're going to avoid many, I'm not going to say all, you're going to avoid many of the major restorative procedures that sometimes are uncomfortable or can cause discomfort. I can't tell you how many times we do root canals and extractions that the dentist will say, if that family would have been bringing their child to the dentist starting at age 3 or 4 every 6 months, we wouldn't be doing this work now at age 6. And that's a very important message for our families that we try to get across to them. The dentist is not just to solve a problem. The dentist is to prevent problems. And I think if you look at anything in healthcare, that's one of the goals, is to get folks to pay attention to their overall health on a preventive basis, on a regular preventive basis. And we're going to avoid a lot of the big problems on a prevention level.
Well, Jackie, I want to talk back about one of the things you said. We've got Jordan Valley here today, Community Center, and they've got several locations too. We've got Dr. Rogers, we've got Karen here. And one of the things that you touched on, I think, is extremely important. You know, it's not just about your teeth, okay, and your oral health. It's about your total health. And we're going to talk with Jordan Valley about your total health. We're talking about behavioral health today because that's what we've been talking about. But, you know, if your teeth are all messed up, it can cause heart damage. It can cause all kinds of things. Think about a young kid, just maybe they're just going to school, starting to go to school, first grade, second grade, third grade. They've got bad teeth. They've got dental infections. They've got all kinds of things going on that they're not taking care of. And it's going to affect the way they study, paying attention, their attention. I mean, everything. It's all about your total health. And that's why I'm glad you're here today. I'm glad that Jordan Valley's here today because we're talking about total health. People think sometimes, oh, it's just your mouth. No, your mouth, you know, you can have all kinds of cancer in your mouth too, and things like that. You got to have those examinations. And I agree, every 6 months or a year at least, you've got to have those examinations. So, you know, these people are low income people, very important people, good people, and you do a Medicaid clinic because most dentists in the Springfield area, around the state, other states, they don't take Medicaid, do they?
That's correct. And it's not the dentist's fault.
No.
The state of Missouri is behind in providing the right level of reimbursement for local private practice dental offices all over the state of Missouri, even in smaller communities. They're not able to take the Medicaid referral because the reimbursement rate is too low. That's not their fault. And dentists will say, I would love to see kids on Medicaid if I could cover my costs to even have my doors open. Mm-hmm. And it doesn't make sense for me as a small business owner to provide a service where I'm paying out more money to cover expenses than the funds that I would receive. And that's been a long-term problem. And we've had discussions with Medicaid officials and legislators about that issue. And we hope in the future there's going to be some improvement with that. They did add a significant bureaucratic level with the managed care process that we've had to wrestle through and struggle through. All that did was add cost to us without any change in reimbursement. But that's another story for another day.
Well, we worked on it. You know, you and I worked on it up in Jefferson City.
There have been some improvements.
And we have made some improvements, but we need to, and it's not just for dentistry. It's for pharmacy. It's for health doctors, healthcare, all types of things. We pay as much as we can think we can pay up there in Jefferson City, but honestly, we don't pay enough. So we need to help all healthcare providers where they can help more people. And
as a nonprofit organization, we take that Medicaid reimbursement. We see over 6,000 kids a year in our 3 clinic locations, and we make it work by raising funds through grant writing and individual and corporate donations throughout the year, and then also some special events that we do from time to time.
Yeah, so very good. So, you know, that kind of leads us into the next subject. I'm going to let Don talk to you because we have something very important that Jen and I are going to be bringing our lawn chairs over there this weekend, sitting there at the Finley River. I know Don's family is going to be over there, and we just bought some ducks, and you guaranteed us that we're going to win. One of our ducks out of 6,000 ducks is going to swim down the fastest. And so, Don, go ahead and see what's going on this weekend.
Yeah, tell us all about what we can expect this weekend and how that we can help the Child's Center.
Well, I appreciate that. This week is a very busy week for us. We've got a lot of things going on. Our largest annual fundraiser of the year is our hot air balloon glow. And this year, Friday, June 18th, is the 15th annual. I can't believe we've been doing it 15 years. A 15th annual hot air balloon glow. It will be in downtown Ozark at the Finley River Park, right next to the new Finley Farms development. Beautiful park setting down in a valley right on the banks of the Finley River. in the large field there in the park. We're going to bring, right now, I think 7 hot air balloons that are going to set up. The baskets are tethered to the ground. The balloons will inflate, which is an extremely dramatic process if you've ever seen it. And there are plenty of videos that you can find online. And it's a very majestic, dynamic process for the balloons to inflate. Then, once they inflate and are stable, our sponsors that are there for the VIP experience will have a few minutes there. If the wind speeds are low enough, we will then take down the barriers that will allow the entire crowd to come walk around and up close to the baskets and talk to the pilots, get your picture made with the hot air balloons, ask questions of the pilots, and let them show you how the balloon stays inflated, which is from that burner that's a propane fuel that they use. I've been told it puts out 1 million BTUs to heat the air, then the hot air that keeps the balloon inflated. It is an impressive sight and one that is fun every year. We have corporate sponsors led by Ozark Chevrolet. It is the 15th annual Hot Air Balloon Glow presented by Ozark Chevrolet. And the second year in a row, they've been the lead presenting sponsor for the event. We appreciate them. And then this year, our second level sponsor is Air Services Heating and Cooling, All Service Professional Plumbing. And they are the sponsor of our VIP experience for our sponsors. We have a catered meal on site. It's a private meal for our sponsors and our balloon pilots and the crew. And it'll be a lot of fun. We have this great big event inside another big event called the Sertoma Duck Race, which is a 2-day festival, June 18th and 19th, Friday and Saturday. And there's going to be about 6,000 little rubber ducks that are going to go down the river on Saturday night. They all have numbers on them. Lynn, there's 13 that have numbers for you. And Dawn, there's 13 that have numbers for you. The number one duck that comes down the chute and gets pulled is going to win a 2020 Chevy Blazer. Now, that's pretty cool.
I think 249 is the winner. I don't know.
Well, that's a good number. I want you to know I appreciate that. But now the correct answer is the fact that Dawn, you and Lynn are already winners.
Yes.
Because you provided financial support that's going to help children's charities in Christian County.
And we like to do that. So that's
specifically
okay.
Children's Smile Center, Care to Learn Ozark, the Ozark chapter of Care to Learn, and then also Dogwood Ranch, which if you haven't had them, they should be week 14, 15, 16.
We've had them on. They're wonderful.
They are wonderful people doing amazing things. Those 3 charities benefit from the Sertoma Duck Race activities. We're proud to be a part of that.
So, Jackie, we just need to make sure everybody comes out this weekend. It's free to come, right?
There's
right. There's all kinds of food trucks, vendors, music, all kinds of things, booths going on. I think we're going to run out of time, and we've got an ad coming up here, and we're going to change guests. But we really appreciate you being here today. And
thank you.
And I tell you what, awesome job continuing to take care of our young children all over 6 counties.
Check out our Facebook page for more information.
Okay, very good. And we'll go ahead and, Matt, we're going to turn it back over to you, and let's play our commercials.
Enter the talent contest at Axe Fest. $10 entry, $50 to winner, Axe Media Group.
Your sandwich was so limited.
Your sandwich had a lot of butter.
Well, we're now back live on Changing Times on Wednesday. And I tell you what, we've had a great first half program with Jackie Barger with the Children's Smile Center. And now we have a great group of 2 people from Jordan Valley in Springfield, Missouri. And we've got Karen Barrand, and we've got Dr. Aaron Rogers.
Davis.
Oh, David.
Yep.
Oh, sorry. What is David Rogers? Okay. So that should be simple. I know my brother's name, David, so we'll get that right. So,
Okay.
So thank you for being here today, and we're going to continue our discussion. We've done 3 or 4 parts now about behavioral health, particularly drug addiction, alcohol and drugs, and then rehab. I mean, so important to do the recovery and try to get these people back to a normal life again. So I'm going to start out with you, Karen, and tell us a little bit about Jordan Valley, the history of Jordan Valley, and the mission statement. I've read your mission statement. I love mission statements. You can tell a lot about a business when you study their mission statement.
That's very true. And I want to say thank you for having us. And also thank you for mentioning Jordan Valley in the last segment, because that's exactly what we do. We improve the community's health through access and relationships and looking at the entire patient's health, medical, dental, behavioral. It's a whole patient approach. So Jordan Valley started off in 2003 with 1 provider and 2 exam rooms. And now we have 4 regional clinics. We have currently 4 Springfield locations. And we are looking to expand to a 5th location in Springfield. So,
wow.
And the reason for this expansion is due to the fact that primarily we've evolved this way by listening to the community. And every time we expanded, it's due to the fact that we've listened to what the community's needs are.
Well, and most of your patients too are low income families too, right?
That's correct.
I mean, you might have some that make more money, but honestly, I really appreciate the fact that what you guys do, because there's so many people in our city, Southwest Missouri, around the area, around the state that are low income, and they can't be forgotten. Somebody's got to take care of them. So really appreciate that. You know, my daughter Mandy works with you guys, and I wanted to make sure I say that because she'll say, "Dad, you didn't mention anything about me," and she loves to work there because she loves the employees. I know several of them went boating. Mandy took 3 or 4 of the employees boating last week on Table Rock Lake and stuff like that. So I know you all work together well and stuff like that. And so it's just a great organization. But so let's get into, we're talking about behavioral health, but you do everything. Just like what Karen said, you're going to take care of the entire patient from head to toe, everything that you see, because it's all kind of connected. But let's kind of talk first about behavioral health as far as your approach to taking care of a person that comes in. They've got a drug addiction or alcohol addiction. What would you do first with those people?
Well, it really depends on the patient situation. We use a consultative model for mental health in Jordan Valley. So I would say the bulk of the patients that I establish in Jordan Valley have some kind of mental health need. And basically what that means is we have mental health resources. We have a lot of professionals, from behavioral health consultants to psychiatry, nurse practitioners like me that focus on psychiatric and mental health, just to provide the care that all of our patients need. So a lot of patients come in and they have multiple needs. They have physical needs, they have health problems, they have high blood pressure or whatever the issue is, but then they also have anxiety, depression. And a lot of the patients will walk in and they'll say, I have a drug addiction, or I have a problem with alcohol. Sometimes patients come in and they're not willing to acknowledge that. They're not willing to say, hey, I have this issue, or they're not willing to acknowledge it to themselves as well. And so we really approach our patients from a holistic standpoint, and you've got to provide care for the whole patient. It's not about a disease process or a diagnosis. It's promoting health. And just like the gentleman that was here was talking about, we're trying to prevent health problems. And it's the same way for us. We have issues we know are present, but we also want to prevent issues down the road. And I want my patients to have a lot of mental health. I want them to have a good positive self-image and to be able to experience life and to have, a good shot at happiness. And some of our patients need to be reminded of that. And that's my job, is to help them along that journey.
So, doctor, do you see, you're seeing all kinds of drug addiction? You see pain pill prescription medication?
Absolutely.
You see, I guess you see marijuana. You see.
Oh yeah.
You
see
a
lot of our patients,
alcohol,
especially. Yeah. And I have treated a lot of patients with alcohol addiction and people that are trying to stay off alcohol and just different drugs. And some of our patients are drug of choices, whatever you got. So it doesn't really matter to them. But we have some patients that are very specific. They come in, they have problems with heroin, or they're on narcotic pain medication, or just specific like that, or some patients that they don't have a problem with that. They just drink all the time. And so
Let me ask you this. So do you see a lot of your patients that maybe starts out with, oh, just drinking alcohol, maybe beer, maybe hard liquor, then going to smoking, maybe marijuana, just then to pain pills, and just kind of goes up. You probably don't see anybody just immediately starting out on heroin or cocaine or fentanyl. I mean, it's kind of a gradual step up process. That's what I want the audience to hear, because in the state of Missouri, we just passed a Missouri prescription drug monitoring program that I hope will help you all, help the physicians, help the staff, help the pharmacies. It's been interesting because I tried to pass it for 8 years when I was in the state legislature, and we'd passed it in the House for 8 years in a row and failed it in the Senate. This year it passed in the Senate first, and then they thought they'd destroy it in the House, and they didn't do it. So they were surprised. The governor's already signed it. Yeah. He signed it last Saturday, and so pretty excited about it. And I do believe it's not a cure-all. It's not going to stop the addiction. You're still going to see patients.
Right,
you're going to see a lot of patients. But the good news is we maybe can stop some before they get to the next level and the next level. And back when I had my pharmacies, we had 26 pharmacies. They were connected real time. So you could go to Sparta, Missouri, and get 240 OxyContin tablets. We'd see that prescription at 8:30 when we opened up, and at 9:05, somehow that person would be at Ozark with another prescription for 240 OxyContin. And then when you would confront them and you'd say, "Sir, were you just over in Sparta?" "Oh, no, and they deny it, and we'd say, "Well, we have things on the computer that actually told us about that person." And they'd say, "Oh, you know what? That's my wife's prescription that I gave you. I'm supposed to get that next month. Give that back to me." Well, we wouldn't give it back. We'd call the police, but by the time the police got there, the guy'd be gone. But that was how they doctor shopped and how they went pharmacy shopping. And that's how they kept getting it. They were using it themselves. They were selling the rest of it. And I think we can stop part of that. And then hopefully that will cut. I mean, you got enough patients that if we cut you down 10%, you guys wouldn't be hurt any. So I think it's going to be good. I'm glad Holly Rader, Senator Rader from Cape Girardeau, we're going to have her on our show in the next month or so, and it's just going to be awesome. I'm really proud of her for not giving up. A lot of people give up after 3 or 4 years of trying to pass a bill, and she persisted every time. And so great job. So what else do we need to know about Jordan Valley and how you treat patients? So you have the dental, you have the just a normal healthcare side, family practice side, and you make sure that when that patient comes in, they come in and they get the whole treatment of everything, right?
We try really hard to make sure the patient has all their needs met, especially in the same visit. A lot of our patients, they have, it's like the gentleman was talking earlier, there's a burden of transportation. A lot of our patients, they'll come in today, they might not be able to make it back tomorrow. So we try really hard for all of our patients, and that's why we have the integrated health model that we do. Especially with pediatrics, patients can come in, they'll see their provider, they can see a dentist, they can see whoever they need to see, it's the same day, the same visit before they go home. That way they have all the health care that they need. And that's really important to us. And it very much touches mental health and substance abuse as well. Our goal is that anybody that walks in the door is a substance use disorder. If they have problems with mental health, they can see a professional today. We can get them plugged in. We can get things set up. We can get treatment initiated if we need to. We can definitely get their needs started versus saying, well, another night on the street will be okay. That's not okay for us. We want to make sure that we can provide some semblance of care, reassurance, make sure that they're getting their needs met from day one.
Well, I know that, and some notes that I sent, I think, Karen, you sent me notes, and I appreciate it, that one of your goals is to, within 24 to 48 hours, that that patient comes into your facility and you're going to do the assessment, you're going to do a workup, if they need medication, all that stuff, you want to be able to take care of that person within the first day or two. You don't want them waiting a week or 2 weeks or come back and we'll run some labs and do this and that. You want to do immediate care, which I think is extremely important. Karen, let me ask you a question. So you've got facilities in other places in Springfield. Springfield is sprawling, and I agree. You actually probably need another center in Springfield. I'm not going to put you on the spot and ask you where it's going to be, but in Lebanon, I go by there every time when I go to Jefferson City every week, and you got a beautiful facility there. Lebanon, and where are the other locations?
So we have Lebanon, Marshfield. We have the 4 currently, and then the 5th one, like you mentioned, which is going to be off of Grand and Kansas. So it's not a big secret. We've been doing our COVID vaccinations and our COVID
is that where the grocery store used to be?
Yes.
Oh, that'll be a great location.
That is a perfect location. Good choice.
Yes.
Okay.
So thank you.
So the other facilities, do they offer the same type of services?
Yes.
Comprehensive services like that?
Yeah, so to continue, we have Republic and Hollister. Don't want to forget them.
Okay.
But as far as, every location, we have the medical, we have the dental, and we have behavioral health services. So pertaining to substance use, the idea of the program is that a patient can walk into any of our locations and get the immediate help. And, that could be done either face-to-face or by telemedicine. I want to, make a comment as to our supporting staff, as far as, behavioral health consultants and community health workers. They are truly vital with this program as well, because, sometimes it's just, yes, it's the medication first model, but also there's so many other needs that need to be addressed, as far as, transportation, also just the basic needs of, where they're going to sleep that evening, or where they, get their next meal. So, as far as with these regional clinics and with Springfield, it's offered all throughout.
I wish that as we've kind of done these series on behavioral health issues, drug addiction, and things like this, a lot of people, they're either undiagnosed. I mean, there's so many people that never seek help, and some of those people end up committing suicide or doing terrible things and not having a good life. I wish there was a way that we could get more and more people. I think every time you open up a facility, you expand your network to where hopefully we can kind of like throwing a net in the water and trying to catch a bunch of fish. I mean, hopefully you can continue to do that, because there's a lot of people in this country that are needing help. And a lot of people think that they're not normal people when they have a mental health issue, but I think they are normal. I think that there's a stigma about mental health. I know when I was first served up in Jefferson City in 2012, honestly, for the state budget, we weren't spending enough money. I mean, we were spending hundreds of millions of dollars in mental health, but it wasn't enough. It was a small amount. And in 2012 is when they started having shootings in movie theaters. And it kind of progressed to where now they have shootings in churches and grocery stores. I mean, there's no safe place. Concerts, you'd think that you could take your family to a movie theater and that'd be a safe place to go. You'd think you could go to church on Sunday and that'd be a safe place to go. I know when my wife goes grocery shopping once or twice a week, you'd think that would be a safe place, but grocery stores have had a lot of shootings too. And so that woke up everybody up in Jefferson City. And people like Dr. Mark Stranger that we talked about, that is the director of mental health for the state. He was instrumental in helping us get more money. We started giving more money out in our budget. So it's still not enough. We need to still do more, because a lot of people were putting their head in the sand, and they kind of they're afraid. They're afraid of mental health patients. And I can't be afraid.
I want to mention that Jordan Valley, you said the stigma. We think, yes, it is a mental health issue, but our primary care providers are getting their waiver to prescribe, the certain medication.
Oh, you're getting a whole bunch more to do that, right?
Yes. So now they're treating the patient, when they're coming in for their medical, situation. But, just being aware of that substance, like Aaron had mentioned, sometimes, they might not come forth right away. But I'm very proud of the fact that our primary care providers are providing that service as well.
Yeah, how many do you have right now? I know there was notes that you had, I think 18 or something like that.
18 currently.
18
and
that's
we're
certified,
growing, yes.
and you're trying to get what, up to 25 or more? Well, that's
Yes.
awesome.
Yes.
I mean, because that way, every one of those patients that are seeing those physicians, they're going to be able to get the full treatment, the whole spectrum, and not have somebody miss something.
Right.
And so that's awesome too. So what kind of drugs do you guys prescribe over there?
Well, it really depends on the patient and what their specific needs are. We have, like I said, a whole gamut of patients with their own, unique needs. We have patients that come in strictly that have a substance use disorder. They have a problem with heroin, or they have a problem with narcotic pain medication, and they're looking for a bridge to help them get into recovery, to get through, treatment, behavioral health treatment, therapy, things like that. One of the medications we typically prescribe is like buprenorphine, the medication that helps with substance use disorder. I also work with a physician that does pain management, and so we have a lot of patients that have unique pain needs, but some of them have problems with substance use as well. And buprenorphine also works for chronic pain, and so we use it for a lot of different patients. But we also have other medications that we use for patients that have alcohol dependence, or other kinds of drug dependence. Methamphetamine is still very large in Southwest Missouri, and so there's different medications that we can offer to kind of help treat that. But there's also a lot of different therapy and services that we offer as well, and we try to get the patient plugged into as many resources as possible, because one medication is not going to do it.
I bet you have some patients that aren't very compliant. I mean, they may want to be compliant, but they're not very compliant, and so they may actually not take all their medicine. Maybe they're trying to sell some of their medicine. I guess you guys are running tests all the time. You're probably urine analysis and different lab tests. I don't know whether it's blood tests or what, but you want to make sure that if you're going to prescribe a week supply, how much do they get at a time?
It really depends on the patient. Some patients, if they're in pain management and we see them every 28 days, they usually get a 28-day prescription. But some patients, especially for substance use, if they're having issues, we bring them in a lot more frequently so we can monitor them and make sure that they're taking their medication as prescribed. So,
well, my first exposure when I first got out of pharmacy school, I was doing some moonlighting over at Doctors Hospital, used to be called Old Springfield General Osteopathic Hospital, out on South National, and they had a behavioral health unit, and so the pharmacy was right across the hall from that area, and not only would deliver the medicines over there for those people, I had to look in their mouth and look under their tongue and make sure they'd swallow. I thought, I wasn't taught that in pharmacy school. I just thought, if I give you a tablet or capsule, you're going to take it. Well, they put it in their ear. They'd put it. I don't know what they did. They would put it someplace else. They wouldn't take it, And so I had to spend part of my time just making sure you took your medicine. David, you take your medicine. and so that was a new experience. And then when they started acting up, then we'd get the alarm, the signal, and the code, and then I'm supposed to have to run over there and try to subdue them and calm them down, let them pull my glasses off, and things like that. Break my glasses once, scratch me in the forehead one time. That was nice. I think, are we going to run out of time? Well, we're going to be back next Wednesday, and guess what? Critical race theory. We have specialists coming in, driving in long distance. Thank you. Be back next Wednesday.
From a patriot like me, can I get an amen to our